Hi guys, welcome again to your own YouTube channel Ask Your Gynaecologist. I'm Dr. Sonal PARIHAR. Today we have a festival in India, that's Raksha Bandhan, in which brothers and sisters, there's a bonding between the brothers and the sisters, and the sister ties Rakhi. It's like a thread on the brother's wrist, and it's a big festival. That's why I am decked up today. So happy Raksha Bandhan to all the Indians who are watching me. And today's topic is a very important topic because we are going through this week. 1st August till 7th of August is a breastfeeding day, which is celebrated all over the world, and that is why I wanted to make this video. And it is just an emergency video I have made today because my routine video is already with the editor, but before that I wanted this video to be posted on my channel. So guys, breastfeeding is a very important thing, and in India, in my country, there is a lot of awareness about breastfeeding. And if you actually look at India, it's a big country. So if you actually look at the statistics, there may be some places where there is 100% breastfeeding, some places have 50%, some have even as low as 30%. So it depends upon which strata of population we are covering. So now today I'm just going to tell you briefly about the benefits of breastfeeding and what I feel the difference between the theoretically and the practically advised breastfeeding. Now the theory says that breastfeeding should be done for around 2 years because it is beneficial for the baby, beneficial for the mother, and we are going to discuss the benefits very soon. But practically what I have seen is that it is not possible to feed the baby for 2 years continuously because first of all, the babies, they kind of cuddle to the mother's breast, they sleep, they do not let the mother sleep because they're not like trained enough to quickly take as much as milk as they want because they don't know how much hungry they are. So they just cuddle in the warmth and they sleep, and then the mother is just sitting and dozing off, and then the baby wakes up again, suckles again, and then sleeps. So the mother cannot keep sitting the whole day, the whole night. So it's just not possible, right? So first of all, this is the main practical problem. The second practical problem is that babies have very strong gums. So even without teeth, they can bite on the nipple and the areola, and the mothers, they come to me with cracks. Sometimes they even get big cracks which can end up in bleeding, or sometimes collection of pus in the breast. They might have abscesses. So these are certain things which kind of demotivate you to continue breastfeeding. Then sometimes the mothers are too stressed up, they do not produce enough milk for the baby, or the baby is too big, the amount of milk coming from the breast is not enough. In that case, the mother is confused what to do. My practical advice to my patients in India, because in India we have a custom of giving cow's milk or buffalo's milk or goat's milk to the baby, because most of 70% of our population are farmers and they have cattle in their houses and they feed their children with that milk. So my advice is the initial 6 months, your baby's gut flora, your baby's gut, the intestine of the baby is not good enough to digest these kind of milks, because cow's milk is for the calf, the cow's baby, the buffalo's milk is for the buffalo's baby, the goat's milk is for the goat's baby. So they have their enzymes and the hormones to digest that. Your baby is a human baby, so your milk is designed to be digested by the baby, right? So initial 6 months, don't experiment with any other animal's milk. In case you are not able to feed enough milk to your baby and you feel that your baby is still hungry, then you should switch on to the powder milk, that is the formula milk. Now in India, we still have these traditions, these superstitions that powder milk is not good enough. It might just ruin your baby's health. The baby might not like the mother's milk, so they try and avoid this milk. But in foreign countries, in Western countries especially, because I have given my second child was born in England, so my first child was born in India and the second was in England, so I can see the difference, the cultural values. Powder milk is basically made by the scientists after studying the mother's milk, because they know that the mother's milk has exactly the nutrients that the baby needs. So the powder milk has exactly the same nutrients and it's easily digestible, and you should actually, if you have to switch over or you have to mix and match between the mother's milk and the other milk, then the other milk should be the powder milk, because it comes in the box sterilized. It is written according to the baby's weight and the age how much powder has to be mixed in how much ml of water. And if you just keep the sanitization good, then the nipple, the bottle is clean enough, and you store it properly, then it is the best as compared to cows and buffaloes and goat's milk. Okay, so this is one practical tip I want to give you. Second practical tip I want to give you is how long you should be feeding your baby. As I said, practically it is not possible for 2 years. Even practically, I have seen many patients coming back to me with irregular menstruation or loss of weight. The health is not coming up because they are overfeeding their children. Now, why I said overfeeding? Because when your child is just 3.5 months or 4 months, we have started early weaning. Now, this has been started and suggested by pediatricians since long, that as soon as your baby is 3.5 months or 4 months, you should start feeding with Cerelac, which is like mashed rice is there, then Farex is there. These are all formula things which you can either make at home or they are available in the market. So mashed vegetables, then mashed in India we give mashed rotis, that is chapatis, wheat flour. So you can experiment with so many things. There are pulses, there are vegetables, boiled vegetables, mashed. So baby's gut flora is growing. So when you are actually feeding the baby starting from 4 months, and why do you keep on just feeding your milk? The baby's health will not go up, your health will go down, and your menstruation will become irregular. So my advice is, do not extend your breastfeeding after 1 year. Even though you have got no problem, you feel that you can feed till 2 years, fine. Don't do it, because it is of no use. It is going to bring your health down. It is going to give you menstrual irregularities, and your baby's health, your gut flora will not develop, because you're not giving anything else. Okay, so these are certain practical tips that I wanted to give you, because after practicing for 20 years I realized that the books might say something, but actually you should practically not feed your child more than 1 year. Yes, if you have some problems, job problem, or you're not satisfied, your baby is not satisfied with your breastfeeding, you're not producing enough milk, you are an elderly person, your breast is not responding, in that case try to feed for 6 months at least. After that you can stop. Okay, because after that till 6 months your baby might have 2 teeth also coming up, and you might have started feeding the baby some foods, so that should be okay, and then you can switch over. After 6 months you can switch over to cow's milk, because the gut flora has developed, or buffalo's milk, or whichever milk you prefer. Right, so quickly coming back to the benefits that we'll be discussing today, you must be aware of that, but just enumerating them. So the benefits to the baby: first of all, mother's milk is designed for the human baby, right? So it has the right amount of nutrients, good protein, low sugar, so the baby can easily digest this food, this milk, and they have the enzymes to digest this milk, which is good enough for them. So do not feed the other animals' milk, just stick to the mother's milk, and if not, then as I said, the powder's milk is good enough, as good as mother's milk. Secondly, this milk is rich in colostrum. Now what is colostrum? Colostrum is a thick yellowish liquid which is secreted from the mother's milk in the initial 2 to 5 days. After the 3rd day, the white milk starts coming. So this colostrum is very rich in IgA antibodies. These are the protective antibodies which your body produces, because you are an adult, you have already been exposed to viruses and bacteria, so your antibodies are there which you are transferring through the milk to the baby. And these IgA antibodies, they provide a protective covering on your baby's outer surfaces like nose, the throat. So whatever germs and bacteria enter the nose or the throat, they are kind of filtered away with that protective membrane. Apart from that, it also makes a protective layer inside the gut. So basically it is protecting your gut as well from the external bacteria or the infection which enters. So it is very good protective way of providing antibodies, passive antibodies to your baby. Now thirdly, because it is providing enough nutrition which is just enough for the baby, so the rate of obesity, your baby going obese, overweight, is much less. So it is like 30% less as compared to the babies who are fed with formula milk or other things. Okay, so though the mother's milk is protective not just for the infection but even for the proper weight gain of the baby, so the babies are healthier. Fourthly, because there is a good bonding between the mother and the babies have a better neurological development. That means they are smarter, more intelligent, or you can say their milestones are better, probably because of the bonding between the mother and the baby feels secure. So the neurological and the psychological development is better. Coming to the diseases, as I said, it provides a protective layer inside the intestine, as well as it also protects your baby from celiac diseases, diseases related to your to the flu, the cold, the lungs diseases, the gut flora diseases like diarrhea, constipation, because it is kind of producing lots of antibodies and making the gut flora, the happy and the friendly bacteria grow inside your baby. Next, coming to the benefits to the mother. Well, first of all, we have already discussed in my previous videos how to take care of yourself after delivery. Breastfeeding helps you in reducing your weight. Now you already have put on a lot of weight, not just fat, there will be a lot of water retention as well. So it will take an initial 2-3 months for you to actually start going into that catabolic state, because initial 2-3 months you can't diet. In India, we actually have lots of customs of giving like proper ghee laddus. What is ghee? It is a saturated fat laddus with ajwain, with gond, and there were so many things which we follow in the custom. Even I followed that because I did not want to disappoint my mother-in-law, because we have to follow the customs, and every custom has some benefits. So yes, initial 3 months don't diet. Take a proper diet. You might have to take extra calories for your body to produce good amount of milk, and after 3 months you will see that your catabolic state has come and you kind of start reducing weight faster as compared to a lady who is not breastfeeding, right? So you will reduce your weight. Secondly, your uterus, which is big enough till about umbilicus, just after delivery, it has to go down, it has to involute. So that is called involution. So it is faster in ladies who are breastfeeding, which we have already discussed before. So what happens is, when you breastfeed, the oxytocin hormone, which is already there in your body, it is initially produced by the body to start labor pains. If your labor pains don't start, your doctor has to give you artificially oxytocin through the drip so that the pains start. So it causes uterine contraction and the baby comes out. Secondly, when you are breastfeeding, it is this hormone which makes the breasts contract and the milk comes out. So the more the baby sucks, the more the oxytocin releases. Now this oxytocin will let your uterus contract again. So whenever you're breastfeeding, you must have noticed that you have this pain, this kind of pain in the uterus as if it's contracting, and you bleed more at that time. Many patients, they come to me, when I breastfeed, I bleed more. So that is because the oxytocin is making the uterus involute and pushing the blood and the clots out, and it is kind of going to the normal state. So within 2-3 weeks, your uterus will become a pelvic organ again, and it will come back to its normal size. Okay, so how good it is that, like, breastfeeding is helping you reduce weight as well as getting your tummy down because your uterus is going inside. Thirdly, because it is protecting you from getting obese, because it is helping you in reducing weight, it helps you in counteracting, or it protects you from diseases which are related to obesity, like for example type 2 diabetes, hypertension, high blood pressure, heart diseases, even celiac diseases, metabolic diseases, which are generally a part and parcel of obesity. So it protects you from that. Moreover, the most important protection, which I have already discussed in my previous videos, is 28 to 30% reduction in breast cancer and ovarian cancer. So whenever you read the literature of breast cancer, you will see that mothers who have breastfed their babies have a lower risk, 30% lower risk as compared to the mothers who have never breastfed, or ladies who have never had children. Okay. Next, as the children, they are smarter because they develop a bond between the mother and the baby. Similarly, the mothers who are basically prone to develop depression. Now you must have watched my video before. If you haven't, then just go and search for it. Postpartum depression is very common because it is because of the hormones, because of so many external factors. You are stressed, so many things we've already discussed in that video. 15% rate of depression is there in the mothers who are probably first time mothers. So this bonding between the mother and the baby helps the mother to come out of that depression. The postpartum blues are less because you kind of, this oxytocin hormone is a loving hormone. So it develops that love and the bond between the mother and the baby that makes you busy with the baby, and that makes you feel that maternal instinct is there. So it doesn't give you time to think all those negative things. So you're kind of devoid of depression and you feel better. So it's a good feeling that you develop between your mother, between the mother and the baby, that this bonding develops, and this breastfeeding actually helps you in counteracting all those postpartum blues and the negative thoughts. All right. Next, it saves your time and money. And that is very, very natural because you don't have to get up when the baby cries. The breast is always there, the milk is always there, ready amount is there. You don't know how much the baby is sucking because the baby knows how much to suck and your body knows how much to produce. You might overproduce, fine, but the baby knows that whenever the baby is not hungry enough, not hungry, or the tummy is full, it will stop feeding. So it's not like you're overfeeding with the bottle. You don't know how much milk has to be fed. You don't have to get up and heat it because it is at normal temperature. The nutrition is fine, the digestion is fine, the baby is saved from diarrhea and constipation because your milk is just optimum. So money, time, everything is saved, and you develop this beautiful bonding with your child. Okay, last but not the least, you don't have to worry about menstruation. Generally, it is said that when you are feeding your baby, you don't want menses to trouble you, that you have to get up and all that. But of course, this is theoretical. You tend to develop some irregular menstruation, some pain during feeding, and some patients, they come to me with lactational amenorrhea. Now, it is not that everybody will have lactational amenorrhea, because everybody's body is different. Biology does not, science does not actually kind of go well with everyone, right? So generally speaking, 6 months you might not bleed, lactational amenorrhea. But first of all, it is good for you that you are not bleeding, so that you can give enough time to your baby. But secondly, it is not foolproof that you will not conceive, because I've seen so many patients conceiving within 3 months of their delivery. So this is a misnomer. There is a very good contraceptive effect. I uploaded a video 2 years back, that is contraception part 1, in which I have told the natural methods, and I have clearly told that lactational amenorrhea is not a foolproof method to save yourself from pregnancy. So just beware. Whenever you start menstruating, sometimes you don't even menstruate after bleeding, after delivery. You feel that you are feeding, so you are not menstruating, but then you come to the doctor with a big tummy that you are already 5 months pregnant. So just be careful, be smart. Lactational amenorrhea is not foolproof. Secondly, the menstruation that is happening may become irregular. Not every patient, not every woman will experience or enjoy the lactational amenorrhea as it is there. So sometimes you might have irregular bleeding, sometimes you might have to go to the doctor. So what I do, or what most of the doctors would do, initial 6 months we will not give you the 21 days OCPs which contain estrogen and progesterone. We will just put you on some simple progesterone, so that your bleeding does not affect your lifestyle, your bleeding becomes regular, or at least we can stop you bleeding, and you can probably enjoy with the baby. Because initial 6 months we know that the baby is totally dependent on you, you are not switching over to anything else. We don't want your milk production to go down, which normally happens with estrogen, right? So initial 6 months, if you're having problems, we'll give you progesterone. After that, of course, your baby is big enough, you have already started feeding with external foods, or you can even start cow's milk or buffalo's milk, then life becomes easier. So in case you have problems, you might have to stop lactation, or you can just time your breastfeeding according to your job schedule, according to your lifestyle. Like for example, if you feel I can feed in the morning and then at night, then in between or alternately you can give the baby the cow's milk, or if the baby is not big enough, less than 6 months, then you can give powder milk, so that the baby sleeps properly. Because when you give powder milk, the baby's tummy is full, you're giving 120 ml, 150 ml according to the weight of the baby, and the baby sucks. It doesn't cuddle and sleep, because with the breast this is what happens. So if you want to have a proper sleep, or if you want to work, just give the baby some powder milk, some formula feeds, the baby sleeps, you get time to sleep, you get time to work, and then you come back whenever you're free, again breastfeed. So you have to make your own schedule. So there is no harm in giving the baby a formula feed, right? So guys, if you like the video, kindly subscribe to my channel, kindly like the video, do not forget to click the bell button, and also share the video with your friends, right? So I'll be back again with a new video, and a happy Raksha Bandhan to you all. Take care. Bye bye.